You wake up in the morning, and before you've even had breakfast, your stomach already feels swollen. By lunchtime, your jeans feel tight. By dinner, you look 6 months pregnant. Sound familiar? Because if it does, you're definitely not alone. For years, I dealt with bloating almost every single day. It was uncomfortable, embarrassing, and exhausting. I'd sit there wondering, what is wrong with my body? I'd try to suck my stomach in constantly so nobody would notice. Sleeping became uncomfortable. Eating became stressful. And the worst part? It felt completely random. But here's what I eventually learned. Bloating is not one single problem. It's a symptom. And your body is trying to tell you something. The key is figuring out where it's coming from. So today, we're breaking down the real causes of bloating, how to identify what's triggering yours, and what you can actually do to fix it naturally. Let's start with the simplest question most people never ask. When did the bloating begin? Seriously, think about it. Did it start yesterday, last week, after dinner, after a specific snack? What changed? Because a lot of bloating comes from introducing something new into your diet. Maybe you started keto and suddenly began eating sugar alcohols like erythritol, xylitol, or maltitol. Those ingredients are notorious for causing gas and bloating. Maybe you decided to get healthier and started eating giant salads every day after years of barely touching vegetables. Suddenly, your digestive system is overwhelmed. Maybe it was dairy, maybe gluten, maybe one of those healthy protein bars packed with corn fiber or processed ingredients your gut isn't used to handling. Sometimes the answer is surprisingly obvious once you look closely. I remember one woman in clinic who came in panicking because she said, "I'm so bloated I look pregnant." The next day she came back and said, "Well, turns out I actually am pregnant." So yes, sometimes bloating really is pregnancy, but most of the time it's your digestive system reacting to something. And once you identify the trigger, removing it can completely solve the problem. Now let's talk about what's actually happening inside your body. One thing a lot of people don't realize is that bloating can come from different organs in the digestive system. Your stomach can cause it, your gallbladder can cause it, your pancreas can cause it, your small intestine can cause it, your large intestine can cause it, and each one creates a slightly different pattern. There's also a simple technique that can sometimes help relieve bloating almost immediately. Take your hands and gently massage underneath your rib cage, especially the upper right side and upper left side of your abdomen. On the right side sits the gallbladder. On the left, more toward the center, is the pancreas. Sometimes these organs become congested or sluggish. Gentle pressure and massage in these areas can help stimulate movement, release trapped gas, improve bile flow, and reduce pressure. You don't need to press hard, just gentle pressure for a minute or two while breathing deeply. Now, before we go deeper into digestion, I want to mention something important that a lot of people overlook: stress. I had a patient once who told me something fascinating. She said her bloating completely disappeared whenever she went on vacation to Florida and spent time relaxing in the sun. Not because of the food, not because of supplements, because her stress dropped. Chronic stress raises cortisol, and cortisol can trigger inflammation, fluid retention, tension in the digestive tract, and abdominal swelling. That's why some people notice their stomach gets bigger throughout the day during stressful periods. Your nervous system and your digestive system are deeply connected. Now let's go organ by organ. First, the stomach. Your stomach needs strong acid to properly digest food, especially protein. But many people today actually have low stomach acid, not too much. And low stomach acid can create symptoms that feel exactly like excess acid. Acid reflux, heartburn, GERD, indigestion, bloating after meals. Here's why. If your stomach acid is too weak, food doesn't break down properly. It just sits there, ferments, produces gas, creates pressure. Then partially digested food moves further down the digestive tract, creating even more stress on the gallbladder, pancreas, and intestines. One clue is indigestion after eating protein-heavy meals. Another clue? Feeling overly full after meals, burping or bloating quickly after eating. One thing that often helps is apple cider vinegar before meals. Another is betaine hydrochloride supplements, which can support stomach acid levels. Next, the gallbladder. Your gallbladder stores and concentrates bile, which helps digest fats. Think of bile like dish soap breaking down grease. If bile flow is sluggish, fat digestion becomes difficult. That can lead to bloating, burping, belching, nausea, or a heavy feeling under the right rib cage. Some people even feel pain in the right shoulder, upper back, or neck because the gallbladder can refer pain into those areas. If that sounds familiar, your gallbladder may need support. Sometimes purified bile salts can help. Sometimes simply improving diet and reducing processed foods helps tremendously. And interestingly, massaging underneath the right rib cage often relieves symptoms temporarily if the gallbladder is involved. Now let's talk about the pancreas. The pancreas produces digestive enzymes that help break down fats, proteins, and carbohydrates. If enzyme production drops, which can happen after years of high-carb eating, metabolic dysfunction, or diabetes, digestion suffers. One major clue is greasy or floating stool. That usually means fats aren't being broken down properly. And when food isn't fully digested, bloating becomes almost inevitable. This is where digestive enzyme supplements can help. Fermented foods like sauerkraut can also support digestion, and reducing refined carbohydrates takes stress off the pancreas dramatically. Now we move into one of the biggest causes of chronic bloating, the small intestine. This is where most digestion and nutrient absorption actually happens, and ideally, the small intestine should not contain large amounts of bacteria. Most bacteria belong in the large intestine lower down, but sometimes bacteria migrate upward into the small intestine. When that happens, you get fermentation occurring in the wrong place. This condition is called SIBO, small intestinal bacterial overgrowth, and it's extremely common. Here's what happens. You eat carbohydrates, sugars, or fiber. The bacteria ferment those foods. Gas is produced. Pressure builds. Your abdomen expands. That bloated food baby feeling? Often it's literally gas from fermentation. One huge clue for SIBO is this. Healthy foods make you feel worse. You eat salad, you bloat more. You take probiotics, you bloat more. You increase fiber, symptoms explode. Why? Because you're feeding bacteria that are already overgrowing in the wrong location. If that's happening, the solution is very different from what most people think. Instead of more probiotics and fiber immediately, some people actually need a temporary break from fermentable foods. A lower fiber or even carnivore-style approach for a short period can help calm things down. Natural antimicrobials like oregano oil, garlic, thyme, clove, and sage may also help reduce bacterial overgrowth naturally. And one of the most powerful tools for resetting the small intestine? Fasting. Intermittent fasting gives the digestive system time to rest and allows the small intestine's natural cleansing waves, called the migrating motor complex, to function properly again. Now finally, let's talk about the large intestine. Unlike the small intestine, the large intestine is supposed to contain huge amounts of bacteria. This is your gut microbiome. And sometimes bloating here happens because the microbiome lacks diversity. In other words, the good bacteria aren't being fed properly. Most Americans don't eat nearly enough vegetables or fiber. The average intake is shockingly low, and your gut microbes literally survive on fiber. So if someone feels better after eating sauerkraut, fermented vegetables, probiotics, or fiber-rich foods, the problem may actually be in the large intestine, not the small intestine. This is why context matters so much. If probiotics make you feel better, that points one direction. If probiotics make you feel worse, that points another. Your body gives clues constantly. The challenge is learning how to read them. And that's really the biggest takeaway here. Bloating is not random. It's communication. Your digestive system is telling you that something is off. Maybe stomach acid, maybe bile flow, maybe enzyme production, maybe stress, maybe bacterial imbalance, maybe food sensitivities. The goal isn't to silence symptoms. The goal is to understand the cause. Because once you identify the source, bloating often becomes surprisingly fixable. Sometimes the solution is removing one ingredient. Sometimes it's improving digestion. Sometimes it's healing the microbiome. Sometimes it's reducing stress and giving your nervous system a chance to calm down. But your body is not working against you. It's trying to get your attention. And once you finally understand the signals, everything starts to make a lot more sense. Subscribe to the channel and stay healthy.